Harry Smith is one of the co-hosts of This Morning. He had live on the early show, just right around breakfast time, he had live performed in him a colonoscopy.
Really?
Yeah, that's why they call this the Tiffany Network. I was watching it and I was thinking, boy, I'm so glad I switched to high def. But some intrigue. Actually, they had to cancel Harry's appointment because, you know what? Well, Jay got there first.
In this morning's Health Watch, colonoscopies provide a lot of punchlines, but they are serious medicine. And as you know, I had one live on our yesterday. Dr. Jennifer Ashton is here to go through some of the key moments and discuss what they may mean for a lot of other people. Good morning.
I'm proud of you, Harry.
First things first, we were flooded with emails from people who said, I saw it, I've been avoiding it, now I'm going to schedule it.
Right, and that was your goal, I think, which was so important. You probably saved countless lives yesterday. You destigmatized it. You let people see that there's really nothing to be afraid of. And along the way, I think a lot of people are concerned about the anesthesia and the sedation, and are they going to feel it? And I don't know if you remember this, but we have a little video of you seeing some interesting parts of your anatomy.
And before we throw to that, though, let me just say, as we were, telling the audience just after 7:30, we're setting up and we're showing the scope and everything else. I said, next time we come back, we'll be in my colon, and then they put me under.
Right.
And there are different kinds of methods for this.
That's right.
But I was under for a good portion of the procedure that you didn't see, but this is what it looked like when I came out.
What's called the hepatic flexure, which is
hello, liver.
Yeah, not many people get to say hello to the liver.
And it was interesting because I got a lot of emails from saying, were you high or what? And I came to, and as I'm looking at this picture, it's fascinating.
Right. Now, there is a disconnect, and you talked about being out, quote unquote. We use anesthesia called conscious sedation, a drug called propofol, so you're breathing on your own, but you're really asleep. And sometimes there are anesthesiologists there. Sometimes these gastroenterologists are so used to these medications, they know very well how to titrate them and give them in the proper amounts. You also get a drug like Valium, so the anxiety disappears, sometimes a pain medication. And when you wake up, you are able to talk, you're able to say hello to your liver. I could tell you were a little loopy, but people can see there's really nothing to be afraid of there.
You think I was loopy?
A little.
In a sort of charming way?
Yeah, very charming.
Oh, okay.
Very charming.
All right, as long as you go that way. Who needs to get a colonoscopy?
Okay, very
Let's
important.
re-emphasize that one last time.
For average risk people, it starts at age 50. If you get a clean bill of health from your gastroenterologist, you are good for 10 years, meaning there's no polyps, nothing suspicious that they want to follow. For high risk people, now this is important, if you have a family history, if you have a history of inflammatory bowel disease, African American individuals are at higher risk, or if you have a genetic colon polyp condition, then you want to start screening earlier and probably screen more frequently.
Two giant payoffs from this experience. One, the peace of mind is fantastic.
Absolutely.
The other thing is, as we talked so often with Dr. Mark Pochakman yesterday, you know what? If they go in there and they find something, they can literally
remove it.
Nip cancer in the bud.
And we say it's diagnostic as well as potentially therapeutic. And Harry, you know, I've always told you you're a beautiful person. Now we know you're beautiful on the inside as well.
I do. I have the colon of an 18-year-old.
Yes.
That's what they said. Dr. Ashton, thank you very much.
Harry.